What's really changed in rehabilitation is the introduction of technology or high tech into previously what was exclusively pretty much a high touch business. So you go to physical therapy and you would have very much a hands-on approach. And now we have new technology that really ought to be viewed as assisting us to do our high touch therapy. So we have hands-on therapy, where you're dealing one-on-one maybe with the therapist and they're working with you with range of motion. Any of you who've had an orthopedic injury might be familiar with that approach. But the same thing if you've had a stroke. You may be in group therapy, and sometimes patients in a rehabilitation setting think, well, wait a minute, I don't want to be in a group. I think I'm going to do better on one-on-one. And the truth is that you do need some group therapy, is that you will learn from the other patients, that they will show you how to do things, and the social interaction of a group. So there's a place for group therapy. And then the addition of high tech. So what does high tech allow us to do? In another video, we talked about dose, and what it does is it allows us to give more dose. So that if you can't move your hand or have trouble moving your hand, and I can use an electrical device that now allows you to move your hand and to do a functional task to pick up a ball or pick up an object and place it somewhere, and to do that without a therapist hovering over you, you may get more repetitions, because remember we want more dose, of a functional task. And I can guarantee you that as a patient, you're going to be highly motivated by being able to do this and being successful. So robotics, the robot helping you do this functional task, has become an important part of rehabilitation for both upper extremities, lower extremities, walking, vision, and virtual reality. Virtual reality used to be really expensive. Whole rooms were dedicated to this. Now a little device that we can buy at a store and hook up to our television gives us a virtual reality environment in which the patient can now work. So rehabilitation is really both. It's high touch and it's high tech.